This patient was referred to me 13 years ago. 13 years ago in 2011 for endodontic treatment of tooth number 29. Irreversible pulpitis with acute apical periodontitis. And take a look. Starts as one, divides up into two canals, right? And here's the date, as you can see, 2011, so 13 years ago. So we diagnosed the tooth as being irreversible pulpitis with acute apical periodontitis and recommended endodontic treatment. We went through the bridge and did the root canal for her. And as you can see, two canals. And I got a little sealer extrusion there, a little lateral there. This was immediately after we did the root canal for her in 2011, so 13 years ago. And here's the date, as you can see, 13 years ago. Patient came back today for us to look at a different tooth, and we took a x-ray of tooth number 29, and take a look here. That's the tooth. Tooth is doing great and is in full function, and patient's very happy. So 13 years post-op of tooth number 29. 13 years post-op of tooth number 29. So if root canals are done properly, we got a good coronal seal, the tooth should last a lifetime. Of course, other factors are important as well. Good oral hygiene, flossing and brushing, and regular visits to your dentist for checkups and cleanings and what have you. Now let's talk about tooth number 28. Same patient came back to see me, now this time 7 years ago, for endodontic treatment of tooth number 28. And take a look here. Tooth number 28, look at that periapical lucency there. So 7 years ago, and here's the date, as you can see, 5/2/2017, so 7 years ago for endodontic treatment of tooth number 28 this time. So we went ahead and did the root canal on tooth number 28. Remember, we did the root canal on tooth number 29 in 2011, and when I saw her in 2017, that would have been 6 years post-op of tooth number 29. And tooth number 28, again, I saw her in 2017 for tooth number 28. And as you can see, periapical lucency, patient has symptoms. So we went ahead and did this root canal in one visit 7 years ago. Will this root canal fail because we did the root canal in one appointment? This was immediately after we did the root canal for her 7 years ago. And here's the date, as you can see, 7 years ago, immediately after we did the root canal for her in one appointment. Is that overextended guttopercha and some sealer extrusion there? Will those matter? Will doing the root canal in one appointment on an abscess tooth matter? Will this root canal fail because I did the root canal in one appointment? I have a little bit of overextension of guttopercha and sealer there. Will this root canal fail? All right, patient came in for us to look at a different tooth, and take a look. Here's the x-ray from today. 7 years post-op of tooth number 28. As you can see, infection is completely gone. That periapical lucency is healed completely. What happened to sealer and overextended gutta-percha? Gone. No longer present. So 7 years post-op of tooth number 28. We did this root canal in one appointment. One appointment root canals work. There's a criteria, and I've gone over that criteria already. One appointment root canal treatment or retreatment work as long as the criteria is met. So 7 years post-op of tooth number 28, overextended gutta-percha and sealer extrusion does not cause endodontic failure. One appointment root canal, if the criteria is met, works. 13 years post-op of tooth number 29. 13 years post-op of tooth number 29. 7 years post-op of tooth number 28.